So, what did he find? So remember there were 4 behaviours that he was looking at. Smoking, cocaine use, inactivity. It was inactivity among the over 65s actually. But anyway, inactivity and cirrhosis mortality rate. And the negative and positive here is simply the sign of the coefficient in the statistical relationship in the regression model. And the slightly larger font and bold means that was statistically significant. Whereas, in the top right corner here, this negative, community social capital, negative cirrhosis mortality, implies that the higher the rate of the measure of community social capital, the lower cirrhosis mortality, but it wasn't statistically significant. Okay, so it's giving the direction, but not the, but it's not statistically significant. In the bold one below it, higher the percentage married, the lower the cirrhosis mortality rate, and that was statistically significant. This missing box here was the data on inactivity was for married couples over 65, so they're all married. So that's why there's no. That's why married wasn't a variable in this particular equation. So remember these top 3. I've done it again. Why am I so slow to learn? The top 3 are argued to be different measures of social capital. The bottom 3 were the controls, factors that were thought potentially to affect health, that you're controlling for differences between the different states. And, well, there does seem to be a relationship between income per capita and smoking and cocaine use, and inactivity is lower with higher income per capita. So that maybe means these retired people can afford to go and play golf. That's a silly example, but they've got time and they've got resource, and so maybe they can travel around or they can do more. Higher income associated with lower cirrhosis mortality. Education, it's not significant, but more education, fewer smokers, that's what you might have predicted. More education, more cocaine users. Don't know, there's possibly some sort of confounding going on. More education, less inactive. Well, more education, you shouldn't, you're more likely to know inactivity is bad for you. Not statistically significant, however. And finally, more education, less cirrhosis. That might be plausible. So, he's found some evidence here of significant relationships. The point here is, we're not anywhere closer to knowing that they're causal, not in this study. They're just associations, but they're associations that he was predicting from his theoretical model. Okay, so that's an example.
I'm not quite understand clearly about the blue lines and the green. You said the last,
Yeah.
the first 3 variables. What?
All right. Okay. So thank you for asking, because it's really important. You do ask, because if I sort of just say something and then I think, okay, that's fine. So it's good that you ask. Let's take the first one. So these are 4 different equations, 4 different outcomes that's been looked at. So for example, what is the percentage of probably adult smokers in each of the 50 states? And you're regressing that percentage, that's the dependent variable, you're regressing the percentage on these independent variables. Now, three of them are argued to be measures of social capital. Another three are included as control variables because it's thought they might be important in influencing health outcomes or health behaviours. Here it's a behaviour, percent smokers. And so you're putting that in because you're trying to isolate the impact of social capital on, or the association between social capital and the behaviour. And so you want other reasons that drive differences in smoking, you want to control for. And that's why I've made them a slightly different colour, just to remind myself.
Thank you.
Okay.
So the result in the blue means the ultra control.
So the blue ones are, to the extent that they're statistically significant, some of them are, and they're the expected sign, that would be support for this relationship between social capital and health behaviours. The grey ones are there to control for differences between states in factors which might influence health or health behaviours. And a few of those were significant. Well, not very many, but a few of them were. So he would argue he's come up with evidence of how social capital is influencing health or health behaviour, and he would kind of, well, almost ignore this bit because it was in there to control for differences between states. I'm quite happy to highlight this bit as well because of what I was just arguing in the previous slide, that arguably these things, the education measure, maybe the socioeconomic measure, might also be related themselves, not just to health or health behaviour, but also related to social capital.
So you've done it by regression analysis?
That's right. This is, maybe if I'd actually put numbers, you'd see, oh, it's a regression. Yes, so the percent, for example, you've got 50 observations, one for each state, and the dependent variable in this case would be what percentage of adults in that state are smokers. 18%, 25%, 12%. And you're regressing that percentage on these measures. So for example, on the percentage of people in the state who are married, on the average family size in that state. And so what you're then trying to see in the regression is, as family size increases, is that associated with any difference in level of these behaviours? And that significant negative coefficient is saying, maybe this is surprising, that larger family sizes are associated with lower rates of smoking.
So when you input the explanatory variables, there are 6 variables, right? So the other 5 variables are controlled variables.
You're putting all 6 in at once. These 3 here, he argues, are control variables. These 3 are, for him, social capital variables. But they're all in the equation at the same time.
So you start them at the same time?
That's right. Multivariate regression, you've got them all in at the same time. Yes,
It's kind of question and comment at the same time.
please.
Your question before was, is there a relation between the 3 last variables and the social capital? And you connected it just to trust.
Trust, networks, possibly social norms, although whether we're managing to pick up social norms here, well, maybe marriage.
I think these 3 variables are very three. So how can you put them in the same model using them as controls?
These.
Yes.
Well, how can you? How can Folland? I didn't. We have an expression, don't shoot the messenger. I'm just the messenger. I agree. I think it's quite possible that they are related to social capital in some way, and therefore, if you include them, and they are, well, equally, if you exclude them and they are, you're going to change your results. And he doesn't seem to have, well, he hasn't, he's ignoring that.
Yeah, so there is no justification in his study of it.
I don't recall him justifying it. I mean, he's a little bit sort of, and it's a very good paper. He sort of says, well, and these were included as control variables because they were expected to influence, plausibly, I think he uses the word plausibly influence health. And the unstated bit is, and not be related to social capital. But he doesn't actually say, and not related to social capital.